Hello, my name is Matthew Kim, and I'm here with Denise Zhong, and we are undergraduates from the University of California, Davis. We are here to present on the analysis of oxidation saturation measurement R2' for Moyamoya disease. We would like to declare that we have no financial interests or relationships to disclose with regards to the subject matter of this presentation. Imaging of spin realization rates R2' is sensitive to oxygen extraction fraction in brain voxels, but they are susceptible to inhomogeneity within the body and vary by person or time of day of the measurement. Therefore, we set out to characterize the reproducibility, determine its relationship with oxygen 15 water per cerebral blood flow, and evaluate R2' as an indicator of oxygen extraction fraction in Moyamoya patients. Our cohorts consisted of 9 healthy volunteers scanned on 3T PET MRI with multiparametric acquisition for 2 sessions 1 to 2 weeks apart, and we also had 14 Moyamoya patients scanned with the same PET MRI protocol only for a single session. For our methods, we took T2 and T2 star for both healthy and Moyamoya patients. We calculated their R2' maps from their respective relaxation rates and registered these to the MNI template. We thresholded these R2' maps to take out physiologically irrelevant values, and specifically for Moyamoya patients, we also masked out lesions and white matter hyperintensities. For our analysis, we took 20 total aspects regions from the median of the brain, and we 10 layers from the top and 10 layers from the bottom. And we took reproducibility with CBF analysis for healthy control, and we found stenosis correlation CBF analysis for Moyamoya patients. Across vascular territories, we found an intrapatient coefficient of variation for R2' between 4.4 and 8.3% in vascular territories. This indicates good R2' scan, rescan reproducibility. And also, as expected, R2' was inversely correlated with PET scan of cerebral blood flow in healthy controls.
Individual cases from the Moyamoya cohort were then examined to investigate possible relationships between R2' and patient pathology. Classification of normal, mild, or severe stenotic grading was performed by neuroradiologists on MR time-of-flight angiograms. ROIs defined by the healthy control study were used to approximate the regions for occluded cerebral arteries, as shown in the first diagram on the top left. Relative R2' values with respect to healthy control averages were then calculated per ROI. This ratio was performed to serve as a baseline comparison between healthy and Moyamoya cohorts. As shown with this unilateral Moyamoya case, there is less change in the posterior region with respect to the healthy control. However, there appears to be some degree of R2' elevation across the whole brain, irrespective of anatomical status. More notable increase in R2' within the left middle cerebral arterial territory corresponded to the occlusion stenosis rating designated by the physician. The right side of this figure shows perfusion status of each region of interest determined via PET scan. Average CVF was calculated per ROI in addition to percent CVF augmentation following an acetazolamide challenge. A distinct correlation was found between the anatomical and functional status of the severely occluded regions. The figure below shows a negative change in CVF following acetazolamide, suggesting hypoperfusion at the occluded site. Although limited to the singular case, there appears to be some potential in examining elevated R2' in relation to anatomical and perfusion status of Moyamoya disease. In conclusion, from this healthy control cohort, results demonstrate that R2' has the potential to be a practical, reproducible measurement of blood oxygenation in the brain for neurovascular diseases affecting OAF, including Moyamoya disease. From the 14 Moyamoya patients, elevated R2', which is indicative of abnormal high OAF, was observed in brain regions with and without arterial stenosis and provided complementary information to cerebral perfusion. The limitations in our study include the susceptibility artifacts in the anterior region due to the air tissue interface at the nasal cavity. Further investigation may be necessary to correct for this artifact. Additionally, as the cerebrovascular arteries were separated discretely by spatially determined ROIs, this may limit functional interpretation of our designated vascular territories. Heterogeneity of the Moyamoya cohort, such as unilateral versus bilateral status and diverse acetazolamide response, could contribute to the potential of collaterals or other confounding variables which could impact analysis and generalizability of results. Therefore, there is further need to study R2' in relation to perfusion status as well as cerebrovascular pathology.